You're welcome to Growth In. My name is Odunayo. I am a public health professional and an affiliate member of the Royal College of Obstetricians and Gynecologists in the United Kingdom. About a couple of days ago, I posted a video talking about the 7 symptoms of ovulation. We spoke about breast tenderness and so many other things that you would like to listen to. And based on the reactions I got, I stumbled on some other channels that were talking about issues around women's health, around fertility and all, and then I stumbled on Infertility TV. And guys, Dr. Maurice of Infertility TV is actually doing a great job. So I saw some couple of videos. There was one he was talking about ovulations, and he said what causes the problem of ovulation. Yes, I think that was the title of the video, and he did a great job. But despite that, checking the comment section, there were a lot of questions from women asking about their particular issues and all that, and this was actually the similar things in some other videos. Like I saw a video from Nucleus Medical Media, and there were also questions, and this is because women, our body works differently, and there are particular questions that are particular to us. So I've gone all the way, I went all out, and I compiled 15 frequently asked questions on ovulation, which I'll be discussing with us in today's video. Let's jump right into it. The first question says, how do I know I am ovulating while my period is not regular? If you have an irregular period, the best way you can know if you're ovulating is to track your ovulation, and for you to do this, you can use the ovulation prediction test kit, which is a small strip just like a pregnancy test strip that you can use to test your urine to monitor luteinizing hormone, which is the hormone that is secreted by your reproductive organ when you are about to ovulate. That is the best at home thing you can do. You can also do some further tests or ultrasound scan in your lab just to know if you're ovulating, if your period is irregular. So the second question says, how do I know if I am ovulating with cycle day 26? If your cycle day is 26, the best thing you can do is just to divide your cycle day by 2, which will give you 13. You had 3 days before and then 2 days after. So based on that calculation, you are most likely going to ovulate on cycle day 10, 11, 12, cycle day 13, cycle day 14, and cycle day 15. So based on your cycle day, if you have cycle day of 30, you just do that to divide it by 2, add 3 days before, 3 days after. That length of days, you are most likely going to ovulate. The third question says, I get cervical mucus during ovulation. There are various reasons why you might not get cervical mucus during ovulation. You should always remember that your cervical mucus is actually being secreted by the glands on your cervix. Now, if anything is wrong with the pH of your vagina, and then anything will distort your vaginal discharge, maybe yeast infection, maybe trichomoniasis, or whatever reason, you might not actually see the cervical mucus. It does not mean that your body is not producing it, and sometimes your body might not produce enough cervical mucus that is noticeable. So you might not want to totally cancel it that you do not produce cervical mucus, and also this cervical mucus does not totally give you the pointer that you ovulate. So if anyone is asking this question because they think they are not ovulating, the answer is you could probably be ovulating and not actually notice the cervical mucus. Another question, which is the first question, says, can I ovulate when I do not have breast tenderness? The answer is yes. Just like I treated the issue of cervical mucus, breast tenderness is just one of the pointers to ovulation. As a matter of fact, this month you might actually notice breast tenderness, and next month you might not notice breast tenderness. So it is not the totality of what your ovulation is about. And of course, you do not ovulate from your breast. So thanks to Jesus. The first question says, is it possible to ovulate 4 to 5 days after ovulation? Okay, sorry. Is it possible to ovulate 4 to 5 days after period? The answer is yes, and this is dependent on 2 factors. The first one is 1, your cycle length and your period length. If your cycle length is short and you have a long period length or long days of period, then it is very possible that you would ovulate 4 or 5 days after your period. For example, your cycle length is for 24 days, meaning that you are supposed to ovulate at the middle of your cycle, which is day 12. Now, if your period length is actually long, for instance, for 7 days, that means that you end your period on the 7th day of your cycle, and then you are expected to ovulate probably at the middle of your cycle, which is cycle day 12, for those that have 24 days length of cycle. If you count from 7 to 12, that's 7, 8, 9, 10, 11, 12. That is 5 days after your period. So it will be very normal for somebody who has 24 day cycle length and 7 days period length to ovulate 5 days after their period. And if possible, if the person is ovulating 3 days earlier, that means the person will be ovulating probably on cycle day 9. So imagine that you are actually ending your period 7 days after, and then you are ovulating 2 days after, which is cycle day 9. So sometimes it is very possible that when you are ovulating very close to your period, because one, your cycle day length is short, and then your period length is actually long. So for this reason, it is very normal that you ovulate either 4 or 5 days after your period. If you are still watching this video, it means you are totally interested in what we are doing in this community. I'd like you to know that although I've been into community health mobilization for well over 7 years, I just started this online community about some couple of weeks ago, and I would love you to be part of this community. And for you to do that, please kindly subscribe to this channel, click on the notification bell so that you can get our videos as soon as they pop up, and also please like this video. It helps YouTube to recommend this video to some other women that are going to find it beneficial. And then please ensure you watch this video to the end. It just tells YouTube that we are doing great here. You are part of this community. In return, I would be giving shout outs to my new subscriber. Just watch this video to the end. Most likely I'll mention your name. Let's get back to business. Question number 66. I had PID that was well treated, but I had not ovulated for about 2 months. Now, if you don't know what PID means pelvic inflammatory disease, and it's just meaning simply means infection of the pelvis that can actually affect your reproductive organ. And she said this was well treated, but she had not ovulated for 2 months. Lady, this is tricky. Before you conclude that you had not ovulated, you have to be sure that you have tracked ovulation. You have looked for those things that are pointers to ovulation that could actually tell if you are ovulating or not before you make that conclusion. And since you said your PID is well treated, you have to dissociate your PID and you not ovulating. There could be many other reasons why you have not ovulated aside the PID, or probably maybe the pelvic inflammatory disease module. Maybe you were thinking the pelvic inflammatory disease had actually done something wrong with your reproductive system. You have to investigate that too. But pelvic inflammatory disease, you not ovulating, they are not, both are not associated. I think that is the word. Both are not associated, so you cannot just bring it together to make that conclusion. Another person said, I had regular periods. She was so specific. I have regular periods and has never missed a period or had late period, but still unable to conceive. Now, the fact that you are getting your period regularly is a pointer that, oh, you are ovulating regularly, but that is usually not the case. What I am saying is this: regular period does not translate to regular ovulation. You can get your period regularly and you are still not ovulating regularly. There are so many medical explanations for that I will not go into. So the first thing you have to do is track your ovulation. First of all, clear the issue of ovulation. Ensure that you are ovulating. If you are ovulating, then you can then investigate further, because there are so many reasons why a woman will not conceive, even after having a regular period that is out of ovulation. There are so many other reasons. There could be the blocked fallopian tube, there could be so many other endometriosis, a lot of reasons why a woman might not conceive even though she's ovulating regularly and she's getting a period regularly. Another question that was asked is this. She said, I keep getting peak on my OPK 2 to 3 times. Does this mean that I am ovulating a lot? The word ovulating a lot is somehow, it does not follow the physiology of the make of a woman. You can ovulate probably 2 times, but you ovulating a lot, well, but what is recommended is this, that as soon as you use your ovulation prediction test kit and you get a peak, you stop testing. The reason is this, because the LH, the luteinizing hormone, might linger for a while in your urine, and then if you keep testing, you think you keep ovulating, but no, that is not the case. So it is recommended that as soon as you test and you get to pictures, stop testing. Somebody else asked, she said, how can I time my ovulation and get a baby boy? It is very possible to time your ovulation and get a baby boy, but this is usually not 100%. And what you have to do is that when it is you actually stay away from intercourse until you are sure that you are ovulating. That is for a baby boy, until you are sure you are ovulating, and then you have intercourse about the time of your ovulation. Increases the chances of the gender of your child being a baby boy. And then there are so many other factors that comes into play. Another thing is that you are predicting your ovulation even correctly to start with. Then the 10th question says that, why am I not able to predict my ovulation through OPK? There are so many reasons. Number one, if you are not using your OPK correctly, if you are not using it correctly, you would most likely not get a positive. And then it is usually advised that, I particularly advise that whenever you are using the ovulation prediction test kit for the first time, please use it with the guidance of an expert or somebody who has been using it for a while. It will help you. This is because sometimes you can test for ovulation now, and the result is actually negative, and then in about 3 hours later you can go back, test, and then you will get your peak. So it's somehow tricky, and you have to pay a lot of attention to it when you are using it. That is one. And another thing is that the OPK might be faulty, it might be bad. The third thing is that probably you are not ovulating. Those are the main 3 reasons that I can give for now as to why you are not getting a positive OPK. Then the 11th question says, how do I handle sexual urge during ovulation as a single lady? This was the issue that I really spoke about at the end of my video. The video I was referring to about 7 symptoms of ovulation. As a single lady, if you are ovulating, sexual urge comes, it is normal. There's majorly little or nothing you can do about it, but the best way to handle it is to take your mind off it and try to engage yourself in so many other things that will take your mind off sex. That is the best advice I could give to you. Another person said, what are the ways to know if I have ovulation problem? I get a positive OPK but still not pregnant. I've mentioned it before. There are so many reasons why you are getting a positive OPK and you are not pregnant, but this one is okay. This particular person wants to know if she has ovulation problems. There are various reasons that you can track your ovulation. Another thing is this: you can do what we call folliculometry, which is actually a procedure with which you monitor the release of the ovum. I think that's the ovum from your ovary. That is done through a scan. You can go for that scan, and then they monitor it. They will monitor as the egg is coming out of your ovary through a scan, so they'll be able to see it. That is another way you can know if you're actually ovulating. So if you really think that you have ovulation problem, despite the fact that you are getting a positive OPK, which means that your luteinizing hormone is actually surging, and then the egg should be released from the ovary, but you are thinking probably the egg is not released, that will perfectly work for you. Just go request, maybe you through your gynecologist, or for instance, if you are in Africa, it's possible you could just walk into a diagnostic center and request for what is called folliculometry. They will put you through how to do that. Another person says, can I take migraine medication during ovulation if I am trying to get pregnant? Yes, you can take migraine medication during ovulation if you are trying to get pregnant. Okay, but after you think implantation must have taken place, please be careful with the kind of medicine you take, and then you should also be able to talk to your maybe pharmacist or your doctor before you just jump on any drug, either for migraine or for whatever reason. Another question says, how soon can I start ovulating after a fibroid surgery? A fibroid surgery, which is also called myomectomy, can actually affect your ovulation, but majorly after 6 weeks it is expected that your body will then start to readjust. So most likely after 3 months max, your body should be able to function normally, as it maybe not totally as it used to, but it should be able to ovulate, at least if nothing is wrong and the procedure actually went well. In the coming days, I should be able to share a personal story as regards myomectomy and how I was able to recover, and share some of my recovery tips with you. You can look out for that. The 15th question, which brings us to the last, says, my period has been delayed but I keep getting a negative pregnancy test. How can I know if I am pregnant? There are various reasons why your period can be delayed. You could be stressed, you could be anemic. There are so many reasons why change of location sometimes might even delay your period. But if your period is delayed and you are testing for pregnancy and it's coming out negative, it is better you see your doctor or you go for a blood test. After going for a blood test and then it is still negative, you are not pregnant, then you are advised to do what you call watchful waiting. You wait for a while and wait till the period comes, and then if the period does not come, you can go to your doctor. They are going to give you medications that will help to bring out your period. So guys, I hope these 15 questions answer some of your questions. If you still have some other questions that I have not spoken about or that you really want me to talk about, please leave them in the comment section. A big shout out to my new subscribers. I picked randomly, guys, and I want to say shout out to Grace Oluwatoye, Odetoyibo Ibrahim, I have Eka, Akishama, Lola, Pitorius, Dot, Jordana, Patricia Modrio. If you want me to say shout out to you, please subscribe to this channel and join this community.